we have 69 million Americans that are eligible for Medicare. Open enrollment's an important time. Can you kind of lay out a little bit the importance of open enrollment, what people need to know?
Medicare is the crown jewel of our social safety net system. It's yours. We pay into it. That little bit of your check, every 2.9% every time you get a paycheck, that's what it pays for. And when you don't take advantage of it, don't use it, it makes me feel badly because I run the program. And of the 69 million people could benefit, a good number have figured out that medicare.gov is a smart place to go. But I want everyone to understand that. And here's the deal. You go to medicare.gov, you sign in. We know a lot about you. We know what medications you're on because we pay for them. We know a bit about your doctors and et cetera. So, but you can fill us in with some more information about new doctors you want to see, medications that you're starting to take, et cetera. And based on that, we can give you some advice about whether you should stay on original Medicare or go to Medicare Advantage. And there's two different systems. The difference is pretty straightforward. The original Medicare, lots of flexibility, go where you want. That's one that was created 60 years ago. Newer Medicare is run by insurance companies that's designed to be more efficient, and therefore they can give you some money back in different ways. So those two programs, your choice, they're 50-50. So obviously half the country loves one, half the country loves the other. It's your choice, you pick. But go to medicare.gov, use the tools there to figure out what's best for you. And if you don't like websites, you can call 1-800-MEDICARE. Somebody who works for you will answer the phone and help you navigate the system. This way, when everyone's looking at television shows with being plastered with ads for Medicare Advantage programs, you'll know if it makes sense to call one of them back. And if I give you one last pro tip, Eric, you don't want to talk to someone who calls you unsolicited about Medicare. They're lying to you. No one should ever do that. They're trying to steal your money, trying to steal your beneficiary number. Don't talk with them. You should be the one calling out to get advice.
Is there anything new that people should know about this year, compared to previous years with Medicare?
There's lots to know that's new about Medicare. By the way, you're changing too, so your changes may adjust the advice we give. But within Medicare, you've been asking us for a long time to tell us whether your doctors or new doctors potentially are members of an insurance system you might want to join. We have that now, and we have the ability to figure out what medications you're on and help you figure out the right plan to make that more affordable. And these tools are becoming easier and more facile. So come to the website, check it out. Again, it's sign in. Don't just go to the website, sign in so you have your own account number. Therefore, we can customize the advice for you.
I want to hit on a point that you hit on previously because I just think it's so important. My father, is on Medicare. I know I have, people that I know that are older that are on it. And a lot of times there is a nervousness that there are scams out there, things along those lines. Can you just kind of reiterate the official kind of trusted sources, not trusted sources, what people should and shouldn't do, and kind of the scams that are out there?
There's lots of scams out there in Medicare because there's so much money to be made. And a lot of these are sponsored by foreign governments. So these are professional groups who are trying to hack you. So a couple tips. First off, it should say .gov. The government owns these sites, not someone else, no private company. No one's making money off you. You paid money to buy this service and make sure everyone else around you has access to it as well. So medicare.gov, simple, straightforward. It's not medicare.com or anything else, medicare.gov. And if you go on the site and it's the government website, then you know you're in the right place. And so once you're in there and you go into your account, and again, you create it the first time you go on, but after that, it's yours. And we're improving the system, so literally it can recognize your face, so we know that it's you. It'll tell you all kinds of things about you, and every year we're getting better at pulling in more information about you so that it's a one source for shopping. With all that information, you're going to have lots of insights about what makes sense. Do I want to be on Medicare, Medicare Advantage? Do I want to look into different ways of paying for my prescription drugs? What are the ways for me to save money? If I travel a lot, is it good or bad that I'm on this program or not? So those bits of information are right there. So it's worth spending a few minutes just perusing the website. And again, I encourage folks to get their loved ones with them in the room. Have a child with you because they're going to be able to give you some advice about whether your decisions are wise or not. And if you're not happy with any of those digital options, 1-800-MEDICARE, it's there.
Talk a little bit about just during the shutdown, the fact that Medicare and Medicaid services are still available for people. Because I've again, in the community, you hear concerns about during the government shutdown, what do I have access to? What do I not have access to? Can you just kind of lay that out a little bit?
Medicare, one of the beautiful things about this program is that both Republicans and Democrats love it. It's not partisan. There's no effort to hurt Medicare with the shutdown. No one's trying to take money away from it. There's no intent to do that, no legislation to do that. It's perfect the way it is. We just need to make it function day in and day out and make sure the pricing is reasonable for it. And all that, by the way, is right there for you to check on your own at medicare.gov. So I think you should feel comfortable around the issue of Medicare. The real question for a lot of folks is how do they stay healthy? Because the most patriotic thing you can do is take good care of yourself. Because if you're healthy and you're flourishing in life and living to the fullest, going out there and surfing as much as you can, then it's going to be a lot easier for you to get through your day without needing a doctor or medication or anything else. And that keeps overall health costs down.
Couple more and we'll get you out of here. Just on Medicare, Medicaid in general, specifically on Medicaid, you know, there has been a lot of back and forth confusion, you know, surrounding the Medicaid, cuts in funding, things along those lines. You know, you're in charge of it all. Can you kind of lay out just, plain, black and white, exactly where the funding cuts were, who would be affected, who is protected, things along those lines, just to kind of, dispel any concerns that people may have?
Most important point to make is that Medicaid is actually getting more money, not less, over the next 10 years. There are no cuts. We're increasing spending about $200 billion in Medicaid. However, over the course of COVID, there were changes made to Medicaid, which are unsustainable. And these were made because there was a public health emergency. But that's gone. We're not in the middle of a pandemic anymore, so we want to take the program back to the way it was supposed to be. To do that, we had to make some changes, and no one's happy when you're taking away something that was given to them, even for a temporary reason, when you take it back. And so human nature is you fight over, but we did what was required to return the system back to the level of integrity that it had before COVID. Now, there's one other thing we added to it. We believe it's important to get America back to work. Now, every Democratic president has felt the same way. President Obama said that. President Biden said that. President Clinton actually passed legislation that fixed welfare by putting work into it as a core tenet. And we believe the same thing, which is you want America working. So if able-bodied people on Medicaid are not encouraged to work, then you're actually diluting services to the most vulnerable Americans. Remember, 50% of kids are on Medicaid or CHIP. So we want money there for them. We want money for older people who don't have much money. We want money in the system for folks who are having trouble, who desperately need our care, who aren't getting better anytime soon. And so in order to preserve those vulnerable populations that we should always be out there protecting, we've got to go one step further and make sure that we protect the integrity of the system. And so we did that by asking folks to go back to work if they're able-bodied, and we're providing systems and tools to help them do that. And we're going to check, because if you don't check, some people won't work. And those, of course, got people upset. We believe we can do it successfully, and that's a major focus of the administration.